Assalamualaikum. Good evening, everyone. I'm Dr. Mehwish with you in another live webinar. It's a free live webinar on the topic of fetal circulation for the students of MRCOG1. Welcome everyone in the session. Before starting the webinar, I would love to discuss a few things with you. I have some queries from the students. It's unlikely that I can respond to all the queries coming inbox because they are a lot. So I decided to talk about them here. So the first thing, guys, students are asking if they have to take the revision plan of 2 months or not. So my answer is that if you are already taking a course and you feel that you can revise on your own and you don't have uh, you don't have this need to take the support for the revision because revision is very important, then you can skip taking the 2 months revision course. And if you feel that you need the support and you will not be able to revise everything important on your own, then you should go for it. I have given 50% off to the students who are already part of the course, and for others, it's very, very pocket friendly. It's $120 only. And it also includes the 14 days workshop, which is the main part and very important part for the revision. Second thing is that again, students are asking if we need to read the books or not. So guys, first tell me that are you all aware of this fact that our exam is only based on SPAs? Part 1 is only based on SPAs. For all 200 questions, they will not give you any other kind of question, no fill in the blanks kind of question, no EMQs, no MCQs. These are single best answer questions, and you have 200 of these. Also, they will not tell you to write a long story or write a long answer about a topic. Like question is not coming in this way that write a note on fetal circulation. How they will ask question, I will tell you in this meeting, and this meeting will be very short. It's not 1 hour long. It will be short. So what should be your approach? You should have a background knowledge. I will only write this BK because it will indicate background knowledge. Now this background knowledge, it's your choice if you want to take this background knowledge from the books. If you want to take this background knowledge from the notes, I have given you very concise and easy to understand notes, and they are covering majority of the important topics. And you don't have to search 2 or 3 books if you are done with the notes. So I will suggest you to read the notes only, not the books. And the third source is Google or YouTube. You should go for that, because why I say this thing, because when you are reading anatomy and you have a good idea about a topic, and if you open the YouTube and watch a 3D video of the pelvic girdle, or you watch the video of the levator and I, it's really good. And if you watch the video on the embryology, the early embryology, it's really good. Because we discussed in the module 1 that visual representation, discussions, everything collectively makes an impact and you retain things well. So background knowledge is the first step. No matter from where you are taking this background knowledge, the source should be authentic and the source should be good. And the source should be time saving, like notes. Notes are saving your time from reading 3 to 5 books. Okay. Now what's the second thing? You should know about the past papers. What questions your college is asking. Okay. You should know this thing. And we are discussing past papers daily. Like daily, we are discussing past papers in our past paper group. So keep in mind that attending the discussions on past papers are also very important. Okay. Then what will be the third thing? Third thing will be to revise. And we have made a good plan for revision. Like I have made a full new course for the students who couldn't join us from the start. And if they take the revision course, they will have this chance of revising everything important before the exam. So I would say follow these three steps. You should have a background knowledge. You should know what college is going to ask, and you should revise that. Okay. If you are able to understand all the things, I'm starting the topic now. So guys, fetal circulation, we all know as doctors that fetal circulation is different than adult circulation. So I want one of you to tell me why fetal circulation is different than adult circulation. What do you think? Yes, you can write the answer in the chat box. If you feel like talking to me, you can turn on the mic and talk. I'm repeating my question, guys. Why fetal circulation is different than adult circulation? What are the factors making it different than the adults? What do you feel? Okay, let me help you in this. So first thing is the role of the placenta. Okay, first thing is role of placenta. Guys, my voice is clear for you all. Is this so? Yes. It is audible for everyone. All right. So I was asking that why fetal circulation is different than adult circulation. And please tell me if my voice is clear now or not. Okay, thank you. So guys, we are talking about the role of different organs which are making the fetal circulation different than the adult. So first organ is the placenta. Okay. Placenta is the one organ which is replacing the role of two organs. Sorry for writing this in this weird way. So placenta is replacing two organs. One, lungs, second, liver. Okay. Why this replacement is given? Because fetal parts are still developing. They are in the stages of the development. So from the day one, they can't give you, they can't, please take care of your mics, Dr. Sonia, Dr. Amber. Keep your mics on the mute. Thank you. So the fetal organs, when they are in the process of development, they can't provide you fully functional organs like liver and lungs, and the roles of these both organs are very important. So placenta is here to provide a support. Okay, so what's the function of the lungs? Basic function, exchange of the gases, right? Gaseous exchange, it is done by the placenta. And what is the role of the liver? It is filtering the blood to exclude the waste products like this. So that function is also done by the placenta. Okay. Exactly. So this whole purpose is served by three shunts. 1, 2, 3. You can name them because I have shared the notes like a week before, and we are discussing these shunts in the recall group many times. I believe in this thing. This is one tip from my side. I believe in this thing. If there is a different topic, if there is a difficult topic, and if there is an important topic, different, difficult, important. These three kinds of topics, you should do them in the groups. You should do them multiple times. Revise these three kinds of topics, do them in the groups. This is the key. And this is the tip for you. Okay, this is the tip for you. So guys, all three shunts, they are saving the developing organs from receiving the blood and work on them. And these shunts are helping establish a different kind of circulation. We call it as fetal circulation. And now we will move to the main part of the reading. Thank you. Thank you for helping team members. Fetal versus adult circulation. Here, one of the doctors was saying that I am unable to give a full focus on the notes, and while reading the notes, because I have to use the screen, I easily lose my focus. So tell me how to keep my focus alive or keep my interest alive in the notes. So I told her that in the coming webinar, I will read out the notes and will tell you how to read them. So if you have got them printed and if you don't have got them printed, either way, you can read the notes this way. Firstly, highlight the important points, only important points. Okay, only important points. And second thing, like just like you make a star, make a sign on a few things which you think that they will require revisions. Okay, if you write a new book on your notes, like notes are already concise and already in the short form. So if you start writing everything on the sides, everything you are writing on the sides, it's not a good practice. The thing you are reading should be very clear. It should be easy to understand. It should be shorter version for the purpose of the revision. And you have a lot of books which have these topics in so much detail that you don't have time to search on that books and read very long topics. So you have to read the crisp notes. And also, guys, the notes should be, very neat and clean kind of thing, notes or book, so that your eyes find them easy to read. So if you are reading this, fetal circulation is compared with adult because the fetus depends on the placenta, not the lungs, for oxygen and nutrient exchange. In adults, lungs are the primary organ for gas exchange, while in the fetus, the placenta fulfills this role. This fundamental difference necessitates the presence of special shunts in the fetal circulatory system to divert blood away from the non-functioning fetal lungs and liver and towards the placenta for oxygenation and nutrient supply. So if you read this one paragraph, if you read this one paragraph, you have this idea that why there is a difference. And we have further explained it this way: oxygenated blood is received from the placenta, not from the lungs. Okay? Fetal lungs are non-functional and blood flow to them is minimal. Nutrients and oxygens are delivered via the umbilical vein, and waste products are removed through the umbilical arteries. Now, I told you that I will tell you what are the important MCQs. So I'm marking the MCQs now. Shunts are doing their role. This is the MCQ. This is the MCQ, sorry, SBA, and these both are SBAs. So they are already highlighted. They're already written in a prominent way. This is how you are going to read the notes. Okay. Let's move to the next slide. You have already told me the names of the shunts. So you can see the first shunt, ductus venosus. Second is foramen ovale. Where they are located, what is the anatomy of these shunts, and what is the purpose of these three, ductus arteriosus. Now we will read. Other parts of the fetal circulation are vein and arteries, and these are named umbilical, vein and arteries. They are coming from the placenta or going towards the placenta. So firstly, we are going to discuss ductus venosus. It is present between umbilical vein and inferior vena cava. What is the purpose of the existence of this duct? We are saving the liver. We are saving the liver. We are bypassing the liver. So most of the oxygenated blood from the vein bypass the liver through the ductus venosus, allowing the majority of highly oxygenated blood to flow directly into the inferior vena cava and then into the right atrium. Direct. Only a small portion of blood flows through the liver because the placenta, not the liver, processes most waste in the fetus. If you understand this slide, there is nothing left that is important and which they can ask in the exam and you can't solve. So this is an MCQ, guys. Sorry, SPA. The location of the shunt, ductus venosus, is first past paper question, and this is the second from the ductus venosus topic. Okay, let's move to the next shunt. You can see the picture of the shunt as well. I totally love these kinds of pictures, which are very simple, very easy to understand and colorful, because I can easily save these pictures in my brain and I can easily use this knowledge while I'm solving the questions. So images are very helpful. So now we have foramen ovale, which is the second shunt, and actually it's the primary shunt. It's the primary one for bypassing the lungs. Again, the first important question in the past papers is the location of this foramen ovale, and it is between right and left atrium. Very easy. Very easy and simple location. It's between right atrium and left atrium. Between the two atria, we have foramen ovale, and it bypasses the lungs. So it's the primary shunt which is saving the lungs from getting the blood. So oxygenated blood, which is coming from the vein, it's going into the right atrium first, but instead of moving into the right ventricle, which is for adult circulation, a large portion of this is shunted through the foramen ovale into the left atrium. Okay. So if in the adult heart, we have 4 chambers and the blood is coming into the right atrium, it will flow into the right ventricle. But in the fetal heart, we have 4 chambers and blood is coming into the right atrium and it's going towards the right ventricle. Okay. Why in the right ventricle? Because there is a passage between these two atria, and this passage is only normal for the fetus. If it is present in the adults, it's a disorder. Okay, so this is only good for a fetus. This passage between two atria. So this allows the oxygenated blood to bypass the non-functional lungs and move directly to the left atrium and then to the left ventricle. Okay, these three arrows are true for the fetal circulation. Now, from where it is pumped to the systemic circulation via the aorta. I've already told you guys, read the things like a story. Read the things like a story. This is the representation I have just made, and you can see in the picture, you can see the presence of two shunts. We have ductus arteriosus and we have foramen ovale. The presence of foramen ovale is between two atria. Now we have to check what is the third shunt and where it is located and what is the function. Like in front of you, you can see first important question from this slide is the location of the shunt between the pulmonary artery and the aorta. We have ductus arteriosus. And what is the function again? It is bypassing the lungs. So any blood that enters the right ventricle, any blood, and is pumped into the pulmonary arteries largely diverted through the ductus arteriosus into the descending aorta, bypassing the lungs completely. So this shunt ensures that blood flow to the lungs is minimal since the lungs are not yet required for oxygen exchange. That's all. So you are done with all three shunts, the purpose of the shunts and the anatomical location of the shunts. Now, a very important question in my mind, and actually this question should come from the students. Students should ask that, Dr. Mehwish, you are talking about the shunts which are important for the fetus. When the fetus is becoming a human being, he is out from the mother's body, what's happening to these shunts? After birth, what's happening to these shunts? Because these structures were important for the fetus only. We are saying if these structures are present in the adults, they can cause disorders. Okay, so can you tell me? Very good. Because in a fetus, when he is a baby now, when he is delivered out from the body of the mother, the lungs and the liver, they will start their function. That means the shunts are no more required. So what's going to happen? Let's see. So when the baby is born, guys, when the baby is born, several major circulatory changes occur as the lungs take over the role of oxygenation right after taking the first breath. And the placenta is no longer part of the circulatory system. These two changes are the main changes. So what happens? Firstly, closure of the ductus venosus. Once the umbilical cord is clamped and the placenta is removed from the circulation, the ductus venosus becomes unnecessary. It closes within a few days after birth. Few days. Your MCQ, your SPA, right? Eventually forming the ligamentum venosum. Another past paper question. Okay. So blood flow is now directed through the liver for filtration and it takes over the processing of the waste. Okay. Now the organ is performing its function. It has been developed, baby is born, so it will perform its function this way. Closure of the other shunts is also very important, and the main thing is the closure of foramen ovale. It should be after birth. It's very important that foramen ovale closes itself after birth. So when the baby takes its first breath, the lungs inflate. Okay, all the alveoli they inflate. And the resistance in the pulmonary circulation, it decreases. So blood now flow into the pulmonary arteries to be oxygenated by the lungs. And also there is no placenta, so we will get the oxygenation from the lungs only. The increased pressure in the left atrium causes the foramen ovale to close, stopping the shunting of blood between the two atria, which is normal and important for an adult. That there should be no mixing between oxygenated and deoxygenated blood. So the foramen ovale typically closes within the first few hours. Another important past paper questions. Days of life and become the fossa ovalis. This is actually not in past papers, but you should know the fate of foramen ovale. All right. Now the closure of the ductus arteriosus. So as the lungs, they just a minute, guys. As the lungs take over oxygenation, blood flows through the pulmonary arteries increases and the ductus arteriosus constricts and eventually closes. So this closure is triggered by the increase in oxygen levels in the blood and a decrease in the circulating prostaglandins, which maintains ductus arteriosus patency in the fetus. Very important point. Okay. So within a few days to weeks, your SBA, the ductus arteriosus closes and becomes the ligamentum arteriosum. And it's easy to memorize because ductus venosus, same similar names, ligamentum arteriosum, ductus arteriosus, the names are same, so it's very easy to understand and memorize. We have a question in the chat box. No, it's an answer from Dr. Sophia that both ligaments or fossa are very good. Dr. Asia, my dear, please take care of your mic. Okay. Now the umbilical vessels. After the umbilical cord is clamped, the umbilical vein and arteries close and degenerate. Okay, they have to degenerate now. They have served their purpose. So what will happen to them? Vein will become the ligamentum teres of the liver and artery will become the medial umbilical ligament. Medial umbilical ligament. Umbilical arteries, I've told you, AL, AL. And what I told you that medial umbilical ligament is different than the median umbilical ligament. So what is median umbilical ligament is derived from?
Urethra.
Well done. Yes, you have already studied the ligaments in early embryology. So you now have to relate this knowledge. Good one. I always tell you guys, when you have information about different things which are connected together, like these all shunts and the vein and the arteries, they are part of fetal circulation. Always do one favor to yourself, make tables. Tables are giving you two advantages. They tell you which which points are similar and which points are different between these things. So make tables, and also tables are collecting all the information at one place. Okay. So if you have all the background knowledge and when there is a question in front of you and the question is about an important point from these shunts, you will only open this table and you will revise everything. Like if you have spent 30 minutes on learning a topic, the revision is so easy that quickly in 30 seconds after reading this table, you can revise everything from this topic. So ductus venosus bypasses the liver, becomes ligamentum venosum. Foramen ovale, right atrium to the left atrium, bypassing the lungs, becomes fossa ovalis after birth. Ductus arteriosus, it is between pulmonary artery and the aorta. It's bypassing the lungs and it's becoming ligamentum arteriosum. Umbilical vein It's giving you oxygenated blood. It's opposite from adults. It's a vein, but it's giving you oxygenated blood, and it becomes ligamentum teres of the liver after birth. And then umbilical artery, they carry deoxygenated. It's again opposite to each other, and it takes blood from the fetus to the placenta, and it forms the part of medial umbilical ligament after birth. And that's all. That's all. Okay. I have given you the summary in another way also. If you want to not to make the tables, then you can revise in this way. Okay. These are the same points. These are the same points we have just done in the table, and that's all. I'm giving you 1 minute to revise the simple and quick pathway. Just 1 minute. Then you can ask your questions. And if okay, guys, when we are in meeting, try using the chat box. Try using the chat box, and don't send me the personal messages which are about the live meeting. So the question is here from a student. Thank you for attending the webinar first, my dear. She says that she is still unsure that if she has to take the exam or not in the January. Okay. So my answer is that don't pay the fee. Don't pay the fee of the exam if you are not sure about the preparation. But you should be very careful about making a judgment about your preparation. Okay. We all are adult doctors. We all are postgraduate students. We are not the babies in the nursery or in the school that they cannot make a decision about themselves. So you should have a sound and solid information about yourself, that if you can clear this exam or not. If your routine, if your level of studies say that you can't clear the exam, don't go for it. Don't go for it. But if you think that by putting extra effort, by putting some extra hours into the studies, you can clear the exam, then go for this. And I'm here to help you by making the things easy. And I'm here to help you by giving the notes and the webinars and the classes and the discussion session in the groups. So it will be easy for you to clear the exam in these 3 months. But if you still feel that 3 months time is not enough for you, don't go for it. Okay. Decision is yours. I won't say that you should go for the exam or not. So if you are done with this summary, guys, and this table I've told you to take the screenshots if you are not the part of the course, because all the course students, they already have these notes. Now it's time to close the session, and if you have any question, you can ask now. Also tell me if you are all done with the expression of interest and eligibility, and have you got the confirmation emails also? All